It's a pleasure to see everybody here today. This is really an historic day for DOCARE. This year they celebrate their 50th anniversary, and it's such a great thing to have an opportunity to dedicate this clinic. And we're looking forward to working closely with ASADE as partners in this and move forward.
We've now created in Guatemala a standstill clinic, a clinic that has 8 rooms, that is one of the most beautiful buildings I've seen down here in Guatemala. It took 10 years of returning to a community over and over and over again, where the community gets to know us, we get to know the community, they become comfortable with what our goals are and our interests are, and learn that we really are there for them. Midwestern's been coming to this area for over 10 years, and if it hadn't been for the multiple groups and hundreds of physicians, medical students, healthcare professionals that had been in this environment, then we would have never been to this point. Over the past 10 years, we've seen 40,000 patients in this community. There have been multiple patients that have had conclusive surgeries that have, changed their outcome, their endpoint, improved morbidity and mortality. I don't know how many hundreds of thousands of pairs of glasses we've given. Every year we come down between $500,000 and $700,000 worth of meds that we bring here. We've earned the trust of the community. Through the trust of the community and through a combination of so many different altruistic organizations, we've now created a clinic that really will improve the continuity of health with the local population.
We've worked for years to establish a continuity clinic. We've thought about it, we've dreamed of it, and we finally have the financial support now and the opportunity to meet the people down here in Guatemala that provide this facility. Student and resident opportunities now exist here on a year-round basis. Having the students here and the residents gives us an opportunity not only for them to be involved in diagnosis and treatment, but it also allows them to get into the community. And with their school system and the paramedics, we can offer them different aspects of healthcare, and the students are going to be directly involved in that. The community is terribly excited about that, and the students are anxious to get going on it. So it definitely is a win-win.
In addition to the patient care, which is our first priority, providing these students with a learning experience to walk into an environment where they may see 100, 200 patients a day, many of them for the first time in their lives seeing a doctor or an osteopathic medical student. It's just a tremendous experience, and they get everything thrown at them in one day. So multiply that by being here for 2 weeks or a month is an incredible experience. They go back, but they want to come back here time and time again because it was so enriching and rewarding and such a learning experience. So great opportunity for our students and for the colleges that support them.
Well, we want 3 students here at a time so that the students can feed off each other, so they can learn from each other, and they can share their experiences and process it with other students. We also want them to be part of the community, so part of the rotation, they're required to do a community service project. So we've got some connections where the students can interact and get a bigger picture of what they're doing and what they're capable of doing for our community.
We had decided to work with DOCARE and donate to this clinic because we wanted the opportunity to participate in rotations. Our board has many different aspects, one of which is international health, minority health, and research. And so we felt that this clinic encompassed a lot of the different things that we try to do as an organization. So we're very excited about the opportunity and looking forward to having something to offer to our members as far as a full accredited 4-week rotation.
San Andreas is beautiful. It's a beautiful area, but it is one of the poorest regions I've seen in Guatemala. So coming to the DOCARE clinic, it was kind of an oasis for us. And seeing the clinic here and the continuity plan that DOCARE has for it has been a huge educational experience for me, and I think it's a blessing to the community. I know we're all excited to come back and support it and to learn from the doctors here and to carry this work into the future.
DOCARE's new clinic is just amazing. It's very clean, they have lots of resources, and I think it's going to be vital to the community. It's going to be a great chance for students to work one-on-one. They can improve their Spanish, and they can really get a feel of the Guatemalan culture.
We've now hired a local Guatemalan physician, which has some huge advantages. Dr. Eric will be on site on a daily basis. The students who are lucky enough to be rotating at that clinic will have direct supervision. It'll be kind of a cross-cultural training.
We need the students. The student needs to learn how to treat people without technology, so advanced technology.
Doing international rotations is great for medical students. You really get to focus on your physical exam skills and history taking skills, because you're taken out of the big hospitals with all of the technology that we have in the United States that sometimes we rely a little too much on. And I think it really is a great opportunity for students and helps expand their breadth of knowledge and also practice their medical Spanish. And if we encourage it now at the student level, we hope that people will continue to do this type of work throughout their careers.
You have a lot to give, and they appreciate every single thing you do, so it's a wonderful experience.
They have to work on their own, and the biggest tool they bring with them is their mind. It's not an X-ray, a CT, an MRI, it's them. It's a great feeling. It's what being a professional is all about. You bring your tools with you. It'll give them a good sense of why it's so important to get the training they get to become a doctor. So it really is an expression of the osteopathic philosophy in practice.